Okay, so welcome everybody who I mostly imagine you're watching via recording, because we didn't really do any promotion of this in advance. I think we were kind of thinking this would be a recorded conversation that would be a resource for people in the future. But this is, I'm Melanie St, if we have not already met one another, and I'm here with Dr. Maury Joseph to have a conversation about something that is really important, but I think can be kind of sticky or vulnerable. And it's about how do you go through the process of reaching out and finding a psychotherapist who is a really good match for you and who you can really trust. So Dr. Joseph, I'm so thrilled to have you here with us. And maybe just to start, would you be willing to share a tiny bit of what it is that has drawn you to the work that you do, and maybe to give people a little bit of empathy for, like, why would somebody want to sit in an office and listen to other people's problems all day?
Well, there's a lot of different versions of that story. There's the one that starts very early in life, for me and probably for most therapists. There's the sort of academic scholarly journey that started more in college. And also, the truth is, my understanding of how it is I came to pursue this career is ever evolving as I learn more about myself and, face new aspects of myself. So it's not a fully written tale either. Mm-hmm. But I will say, I got into this. I got really interested in psychotherapy when I was working my first job after college. I was working for Christ. The psychologists on the ward where I worked were using psychotherapy, and with what appeared to be good results. And I was just totally fascinated by what they were doing, and they saw my interest and supported my interest, and that started up inside me a lot of studying, a lot of reading, pursuing my own therapy, learning more about myself, and so that's the short version, let's say, of how I got into this. But yeah, both. Let's put it this way: no one comes to this field out of pure intellectual interest. So it's a combination of my own growth journey and also just an intellectual interest in how people's minds work, and wanting to use that to help people and help mm-hmm. people get more of what they want out of life.
Mm-hmm. Yeah, it makes sense, and I really appreciate you sharing that insight that it can never be a completely detached and impersonal decision, and that there is a real that there's a constant process of growth and transformation that you are engaged in at the same time that you're supporting others in that same pursuit.
Yeah, and I have no doubt that it's you're called upon to undergo your own in the work. It's part of the job description. I have to
yes.
learn more about myself and self as much as possible in order to be more useful to the people I work with, and the people I work with.
Yes. I'm going to stay off of video for a little bit because I'm getting just a little bit of interruption in your audio, and I want to make sure we can really hear what you're saying.
Okay.
So I'd love to have you talk just a little bit about what you think would be helpful for people to know. You imagine maybe that they've just been in the situation where their herbalist or their acupuncturist or their medical doctor has given them the feedback, I really think it would be so helpful for you to work with a therapist. And I think sometimes the initial feeling that people have there can be one of maybe dismissal, like, are you trying to say that my health problems aren't real? Or one of fear or suspicion, like, are you trying to tell me that I'm crazy? And And then another fear of like, well, how am I going to find somebody who I can trust with really sharing the intimate details of my life? And if there was some message that you could get to people in that moment to reassure them and give them some first steps on the path, what might you say?
Well, I'm hearing a couple different questions in there.
Mm-hmm.
And I will try and address them both. It sounds like the first is around this idea of, are you calling my, this physical illness? Are you calling me crazy? Are you saying this is all in my head, that I'm somatizing?
Mm-hmm.
And I think that is reaction, and a lot of people have it when the referral for psychotherapy is and I always hope that doctors, physicians, herbalists, PTs, OTs, whoever's working with folks before they get referred to me, I always hope that they've done really thorough diagnostic work, and that's usually how it goes. Usually people have had a bunch of testing and treatments approaching whatever they're suffering with from a purely somatic angle.
Mm-hmm.
And the tests turn out inconclusive and the treatments fail,
Mm-hmm.
and usually it's at that point that folks start thinking, all right, maybe it's time for a referral to psych. Maybe it's time to call someone like Maury. And the issue of, is it all in my head? What I've learned, and I think what sort of the best clinical science is saying, there's almost no such thing as a head.
Yes.
We're really walking around in a body mind, or a mind
Yes.
body. It's like you can put those two words together to form a new noun, and that's not my idea. That's coming from people in interpersonal neurobiology and other sort of cutting edge neuroscience.
I think Stanley Kellerman's book, I think maybe from the early 70s, is the first book where I read that term, and I just remember being like, yeah, this is it.
So, and the reality is that the nervous system, so the network of cells that branches off from the brain and communicates with our bodily organs, and communicates to the brain about our bodily organs, basically connects our emotional life with our physical life. Almost every major structure of the body is connected into the nervous system. So skeletal muscles, the smooth muscles of your viscera, your stomach, veins, arteries, capillaries, your urogenital system, your bronchi that helps you breathe, your skin. It's all connected. It's all essentially one. So it's no surprise then that emotional factors can impact physical health, and
Mm-hmm.
and our bodies can manifest physical symptoms in response to emotional factors, in response to the emotional factors that stressors in our life trigger up in us. So is it all in your head? Yes, emotional factors may be causing the whole thing, but the bodily symptoms that you're getting are real.
Yes.
They're really happening to you. Opportunity that you would have in a more psychotherapeutic approach, would be to our emotional roots to those very real physical pains, to those very real cramps, to that very real tension, and see if changing your relationship with your emotions would produce relief from those very real physical symptoms.
Mm-hmm.
So I think that was the first, that was a part of your question, right?
Yes.
Okay.
Um, yes. So then maybe hearing that reassurance and that sense of, okay, nobody's trying to tell me that my suffering isn't real. Then what might the steps be, as someone starts to look for a therapist? Like, how do you navigate, all of the different, there's a lot of kind of jargon out there. Like, who knows what all these different terms mean, and how do I find somebody who I can trust? Do you have any suggestions for what someone could do to make that process as easy and effective as possible?
Yeah. You're so right. There's just so many therapists out there, so many therapies. Um, and I wish there was a very simplifying bit of advice I could give, so I'll do my best. I think the first thing that you can try is reach out to your primary care doctor, any other health professionals you're working with, to see if there's someone that they trust. Friends and family, good source of referrals. If someone has had a good experience with a therapist, that's always a positive sign. Although it's not, it's no guarantee.
Mm-hmm.
Then there's great tools out there like the databases, psychologytoday.com, goodtherapy.org. Those are the two that I interact with most, but I know there's others. Um, now, what do you do then once you have a bunch of people's names? Um, you know, how do you establish trust? How do you decide, oh, this is the person I want to work with? And how do you decide if they're the right person for you, if they're trustworthy, if you think they'll actually be able to help, if they're worth their fee,
Mm-hmm.
And that's where there's no easy answer other than you have to try them out.
Mm-hmm.
That's been my experience. I don't know how you feel about this, but the only way to find out if a therapist is worth their salt is to give them a shot.
Mm-hmm.
Open up as much as you can. Do your best to open up, be honest about what's going on with you, and see what they do with that.
Mm-hmm.
Are they able to reach back in a way that helps you feel safe and heard? Are they able to reach back in a way that produces relief for you, that has a positive impact on the symptoms you're hoping to address? If so, keep going, or if
Mm-hmm.
you like, that would be, if so, you'll probably want to keep going. And if not, it's important to be able to say, this is not working for me.
Mm-hmm.
This is not helping me. And then you can make a decision. Do you want to address that with the therapist? Do you think it's worthwhile to bring it up with them and say, hey, this isn't working for me, and we need to talk about that. Here's what's going on. Or is it time to just say goodbye and try somebody different?
Mm-hmm.
But to me, there's no substitute for trying someone out and seeing what they can do.
Mm-hmm. What do you think is a
Because
good? Oh, go ahead. I'm sorry.
yeah, I was just gonna say, because there's some people who I work really successfully and effectively with, and some people where I'm like useless and clueless, and they would be and they would be
Yeah.
better off seeing a different therapist. And I think that's true of every therapist. So even if I I helped someone get a wonderful result who has very similar difficulties to you, it doesn't guarantee that you and I are going to connect.
Mm-hmm.
But we can try it out. We can approach it with whatever optimism and curiosity we have, and do our best. And if we get a good result, let's keep going. And if I'm feeling not helpful to you, I think any ethical therapist is going to, provide referrals and say, I wish you all the best.
Mm-hmm. So I wonder about, I think that this idea of really giving the relationship a try and experiencing it and kind of entering in, almost like entering in the first gate of the therapeutic relationship, is the only way to get a sense if you want to go through gate 2, gate 3, and continue to work deeper. But I wonder about, in my work, I often have a sense of, well, everybody's different. But for hormonal imbalances, I know we need at least 3 months to kind of see how the cycle is going to change and respond. Do you have any general guidelines of how long is a trial period? Like, how much time might be reasonable to say, okay, I'm gonna commit for blank period of weeks or months to test out this relationship, knowing that of course it's different and like impossible to say 100% for everybody.
Yeah, yeah, and there is some research on this that I don't have off the top of my head a citation for, and some statistics that I could
That's
quote.
okay. That's okay. This is informal. It's no one's gonna hold you to the citation.
Yeah, yeah. Well, I've heard some statistic along the lines of if someone has not achieved any benefits by session 7, they are
Mm-hmm.
unlikely to achieve benefits by session 20.
Okay.
So maybe you could say from the research, okay, there's a rule of thumb we could hang our hat on.
Mm-hmm.
However, for people with more severe difficulties, and
Mm-hmm.
for people who have been carrying around, maybe a high degree of suffering for a long time, and it's pretty entrenched, it would be unrealistic to say you should feel better in 7 sessions.
Mm-hmm.
As much as I wish it were realistic, and
Mm-hmm.
maybe you'll be feeling some improvement or at least some renewed hope, some optimism in 7 sessions. It's you can't always use that rubric. I think a really good thing to do is to talk it over with your therapist.
Mm-hmm.
If you're having concerns about, geez, is this treatment effective? Am I getting as much out of this as I could be getting out of other therapies? That's really something worth bringing up with your therapist and seeing, can they shed some light on that for you? Can that open up a bigger conversation about what's going on in the therapy that might turn out to be really useful?
Yes. No, that's great. I mean, it's always been such one of the things that I think I have found so useful in my own experiences receiving psychotherapy is the learning and the practice of using the therapeutic relationship as a place to have all of these conversations and negotiations, not to feel like I have to carry the weight of it all and figure it out on my own. And that in learning how to do that, even if it's something as essential to the therapy itself as talking about, hey, how long is it going to take for me to feel better? That doing that collaboratively and through conversation is part of how I then learn to get better at negotiating and meeting my needs and all of the rest of my life.
Beautifully said. I really agree. I agree.
So I have one more kind of burning question, and then I'll maybe open up and see if there's anything else that you feel like you would like to share. But I think that the kind of burning question I still have is really about how to think about discomfort in the therapeutic process. So, of course, it seems very basic that you have to be with providers with whom you are actually safe. But I think there's been a lot of confusion, sort of maybe through certain internet discussion forums and kind of conversations about safety and comfort kind of becoming conflated with one another. And that sometimes, what's the balance of becoming too triggered, too flooded, and too overwhelmed with uncomfortable feelings versus knowing that you might have to feel some discomfort in order to actually heal and move through and overcome entrenched patterns that have been running your life for a long time.
Yeah. Yeah, I think a lot of people approach therapy and life. And when I say a lot of people, I can't rule myself out of this one. I don't think there's, I think many of us approach life and therapy with the hope of someday entering a kind of like blissful Zen-like state where there will be no more discomfort and no more pain and no more shakeups, and we'll be sort of purified.
Yes.
I've had a lot of therapy at this point, and so far I I can tell you I'm not purified, as despite my best efforts. I'm still not purified, and I'll let you know if I become purified, or if any of the people I work with report to me that, Maury, finally I'm purified. So yeah. Now, are there types of discomfort that are, you want to say, symptomatic, and a level of discomfort that makes learning difficult? When someone's in like an all-out panic state and they're so anxious that their vision is getting blurry, they're having difficulty thinking. When you're in that state, you're not making new, right? Your hippocampus is shutting down, flooded with neurohormones that are preventing the formation of memories and just trying to help you numb to this high level of anxiety, right? So someone who's in that kind of a state in a therapy session is not necessarily getting the full benefit of that therapy session. That's a very dysregulated emotional state in which it's hard to learn from your experiences. And one way of describing therapy is it's learning from experience. It's having an experience together in which we reflect on it and learn from it. And when you're too anxious, that can't happen. Now, for some people, there will be a part of the therapy, just by the nature of how severe their anxiety is, where they will be that anxious in sessions. It's unfortunate, but I'd be lying if I told you that everyone's anxiety can be regulated right away. However, there is really an optimal range of anxiety, discomfort, in which, okay, yeah, we're tensed up, we're not super comfortable, we're not calm and cool, the way we might be like while we're like zoning out, watching TV in the evening, where we've managed to take our mind off the stress of our day and the body's just kind of cool, right? So we might be tensed up, we might be feeling some anxiety, but the thinking and reflecting centers of our mind are still working. So we can still learn from this experience. We can still be thoughtful about it and glean new knowledge from it. So yeah, there's a huge range of different manifestations of anxiety in the body. There's a window that people call the window of optimal tolerance, or the threshold of optimal tolerance, where, yeah, you're tense, but you're still able to think. And we like that, because it means we're facing difficult stuff, but we're able to learn from it. Right. And then outside that window, we're either not anxious enough, which would suggest we're not facing difficult stuff. We're not facing the stuff that brought us to therapy. Maybe we're chit-chatting about sports or the news or the weather, right? But we're not facing the difficult stuff that brought us to therapy in the first place. Then we're not going to be very anxious at all. It's going to be sort of small talk therapy. And there's that more flooded state where, geez, we're having difficulty thinking, difficulty seeing, difficulty hearing. And in that state, we're not going to learn from this experience. We're just going to be kind of scared of it. So those are some of my musings on anxiety and discomfort in therapy. Sometimes people I work with, my clients, look at me like I'm crazy. When they look at and they're like, Maury, I don't know what's going on. I'm so confused. I don't understand. And I'm like, because if I'm talking with someone whose their whole life was dominated by false certainty and lies they were telling themselves, if they suddenly come to me and they're like, Maury, I'm a little bit confused, I'm like, hallelujah.
Yes.
You've managed to overcome that tendency to have false certainty, and now you're dealing with this very human issue of wrestling with the unknown and trying to come up with some new way of connecting to reality, not through the lens of your preconceptions. So I just say that to say, yeah, like, not knowing what to do is difficult and uncomfortable, but it's also a really important part of human life. If we don't open ourselves up to the unknown, we're not going to come up with new and creative solutions. We're not going to face new things and try new things and learn new things about ourselves. So I'm just trying to underscore what you said in the sense that there's a type of discomfort that is critical to growth. And when I see people going through it in my office, I do my best not to alleviate them of that kind of discomfort.
Mm-hmm. Yes. And to affirm that, I think it's such a beautiful and clear way of putting it. And I think it gives people language too for this thing we're talking about of like, express it to your therapist. You know, it's such a clear way of being able to say, I'm so uncomfortable right now that I can't even think, and I don't believe that I'm getting a benefit. And really, it's a way of asking the therapist, can we titrate this down? Can we regulate it? Can we go slower? And then you can see if they are capable of helping you do that or not. And it's also a way of maybe giving some language around like, gosh, like this is really uncomfortable, but I think I can hang with you. And can you just reassure me that like, it's okay to feel this way, and that you know that we're safe, even if it feels like a whole new world to me. You know, I think that this way of thinking about it really is going to give people some language that they can use, you know, in those initial 7 sessions or however long, to navigate that question really successfully.
Yeah, and especially with those kinds of anxiety that therapists can't see.
Mm-hmm.
You know, I could be looking at someone and they're starting to get a stomach ache from anxiety,
Mm-hmm.
but I have no way of knowing that.
Right.
You know, someone who's got tension in their muscles, they're sighing, they're doing this. I can observe, okay, that person's looking a bit tense, right?
Yeah.
But when anxiety is going into the smooth muscles of the gut, or if anxiety is going into disrupting your cognition and perception, your ability to think, your ability to see the world clearly, I can't necessarily observe that from the outside.
Mm-hmm.
So letting a therapist know that that's going on inside can really be critical in recruiting them to help you
Yes.
with that very problematic and painful inner state. So yeah, I'm just
Yes.
underscoring what you already said, and totally agree.
Yeah, it's a hard thing to learn, speaking very much from personal experience as someone whose emotional distress goes right into my body and is absolutely not visible to other people, because that was the defense that I evolved, was specifically so it would not be visible to other people. It really has taken me a lot of practice first to become aware of what my own sensations are. And then in the moment, it can feel like it takes quite a lot of courage to actually say, right now, I'm so anxious, I feel like I'm going to throw up. Like to have to say that to somebody when they may not be aware. So, but you know, I really believe part of the reason I'm such an advocate for therapy is because I know where I have personally come from, and that there's so much hope for people, even when it feels like this stuff is so hard, that it really is possible to grow and to change and to build those new neural pathways, and just to kind of step by step learn to articulate this stuff and get the support and the skills that you need. So I'm just so grateful to you for doing this work, and for all the therapists out there who are every day just kind of on the front lines. And I wonder, you know, are there any sort of parting thoughts that you would have, you know, maybe if you imagine you know, someone who really could benefit from being in your office, but might not know it, or might not quite be at the point where they're ready to reach out. Anything else that you would say, that you would want them to know?
Huh. Hmm. That's a nice, challenging question.
Hmm.
Um, and I think what it does is it kind of tempts me to guess about what's going on in the mind of someone before they call, you know.
Mm-hmm.
And I'm a good speculator. but you don't want me to speculate because I could go on and on. So what I'll say is the process is different for everybody.
Mm-hmm.
Whatever factors in your life have brought you to the point where you're considering calling, considering therapy, are unique to you. So I hope that you will find a therapist who is sensitive to that, who is sensitive to the specific nature of your suffering, and doesn't see you as a diagnosis or a box that they can approach with a certain set of tools, and all they need to do is use their tools on you, and that will magically transform you. There is something to be said for skills and tools, but I hope that you will find someone who will be sensitive to the deep humanity and complex nature of who you are and the path that led you to this moment. And if you're finding yourself not feeling respected or valued or cared about in that kind of way, and if the therapy is not helping you, I hope you'll reach out and try again. I think it's really easy if you've been burned in a therapy experience or burned in any relationship. It's easy to give up. It's easy to lose hope. I've met a lot of therapists in the short time I've been a therapist who were doing their best and were falling short. And I've met a lot of therapists who were doing their best and doing a good enough job. So I hope that you will find someone who does a good enough job and that you two can put your efforts together and so you can get something good out of it.
That's beautiful. Thank you so much for taking the time, and let me see if I can just come on. Okay. Thank you so much for taking the time to answer these questions and create this resource for people. And maybe just as a parting piece, would you share how people can find you and contact you and where you're located? So, if someone is thinking like, oh, I really kind of like this guy, how they might be able to contact you and see if maybe there's a fit there for them.
Oh, sure. So my website is drmauryjoseph.com. That's drmauryjoseph.com. And you can also find me on the different directory websites, Psychology Today, goodtherapy.org. I write a blog on goodtherapy.org. If you more of my ideas for whatever reason, the blog is out there. And information is on those websites.
Great.
I'm located in downtown Washington, D.C. I work part-time in a practice called Monarch Wellness in DuPont Circle, and also I work part-time in a practice called Claudia Salazar and Associates, which is in Van Ness. And, I just want to thank you, Melanie, for this really cool opportunity. You played to my ability to talk at length about stuff I'm interested in. And I hope we get to talk again soon, because I want to hear more about your work and how we can collaborate. I definitely have, since we spoke first, I've had some ideas about how we could collaborate, and I would like to hear you elaborate more and ask you more questions sometime in the near future.
I would be happy to indulge you. I also can certainly give you a run for your money, waxing poetic or not so poetic about things I'm interested in. So I think we're evenly matched in that regard.
Great.
Thanks again. I'm going to go ahead and close the broadcast. And bye, everybody. I hope that this was helpful. And if it is a helpful resource, remember, you can share this link with friends or family, anybody who might benefit from some of this information. Okay.